Hello, you beautiful complex students, and or handsome, whatever your preference is. What do you call them? We're going to go over some practice questions today. These ones pertain to liver disorders. So that would include cirrhosis, hepatitis, and acute liver failure. Hopefully these questions will help to bring together some concepts about the topics, but also help to talk about some test taking strategies and go a little bit deeper. So let's dive right in. Or let's attempt to and fail miserably. All right, there we go. All right. So question number one, a nurse is caring for a client diagnosed with esophageal varices. Which finding needs to be reported immediately to the physician? So first we need to see what kind of patients we're talking about. So since there's can be a variety of patients in liver, the first thing you want to do is look at, okay, what kind of patient am I talking about here? So it doesn't say what they have, but it says they have esophageal varices. So, as a whole, I'm kind of thinking about like what crisis or what am I dealing with? Because when we talk about cirrhosis and things like that, or it could be an acute liver failure, we're really thinking about, is it a bleeding issue? Is it a fluid issue? Or is it why am I forgetting the last one? Ammonia issue. So those are like the three major issues you have. So right now we're dealing with esophageal varices, which if I know what that is, that's a bleeding issue. And this question's asking which finding needs to be reported immediately to the physician. So that means I'm answering the question, which of these, if I don't report, the patient's going to die the quickest? Or it's the most important to report because it tells me there's something wrong. Even before looking at the answer choices for this question are going to have answers that may be serious, maybe something bad, or could be completely expected for a patient. They may seem bad, but is it expected for this patient? Because remember, in complex or ICU patients, a lot of them, they seem sick, but they ain't that bad. So answer choice A is hemoglobin 10.2 grams per deciliter. So, with that, you'd have to know your normal hemoglobin. And so I'm thinking 10.2, I mean, that's lower than normal. But is it life or death? Like if I don't report a 10.2 right now, are they about to, die on me? Most likely not. We usually don't transfuse until they're less than 7. So right now, that's not high on my list. I am associating the hemoglobin with the varices. So a lot of times, like that's why, some students might choose this first because they're like, oh, hemoglobin, esophageal varices. They also have to consider what the value is. And since it's reported immediately, remember, that means that all of these could be stuff I need to report, but which one do I need to report right now? Next one is black tarry stools. So this is also something about bleeding, but if I'm thinking stools, that's digested blood. So it's a little less scary. Like, I mean, if this said bright red vomit, that sounds pretty concerning, but black tarry stools, I don't like it, but it's not necessarily something that I'm like, oh my goodness, I need to report this, right this second. And we have to think if someone is having esophageal varices, it'd probably be expected that they're having some digested blood and having some signs that they have been bleeding in their GI system. The next choice is blood pressure 89/55. So, for this one, this is the one that scares me the most so far. It's a low blood pressure. And I'm just connecting that if they're possibly bleeding, if their body or vital signs are starting to show signs that they're bleeding because their blood pressure is dropping, it could be showing a sign that they're actively bleeding right now or having an issue with bleeding. So this one so far is the one that, kind of makes me think, the most. So then D is respiratory rate, 22 breaths per minute. So a lot of times ones like this stand out to me because I think ABCs. I also have to consider with this one, is it that abnormal or is it that concerning, or like where is it on the spectrum? So kind of like the hemoglobin 10.2, it's low, but it's not that low. Is the respiratory rate of 22 that high? It's not that high. I don't like it because it's an ABC thing, but is it as scary as the blood pressure of 89/55? Not so much. So what I'd probably do first in a question like this is I would break down and cross out ones that I'm like, oh, I don't think it could be that. I don't think it's the hemoglobin or the black tarry stools. Both of those I think are expected for this patient. I would probably get down to C and D. And then, some people, they would use ABCs and say D. But I think that if I had to answer the question, which of these are they going to die from first, I would have to go with C, because that low blood pressure is saying there's a problem right now where the respiratory rate of 22, and if they've had some blood loss, they might just be breathing a little bit faster. There's, no other signs of otherwise distress. So the blood pressure that low, like there's really no reason for someone with esophageal varices, aside from if they're bleeding out, to have that blood pressure, but there are reasons for a patient to have a respiratory rate of 22. So that one to me, C is most concerning, and it's the right answer. So question 2, a client with cirrhosis is presenting to the emergency room with an upper extremity flapping tremor and decreased level of consciousness. Which prescription should the nurse complete first? So it's talking about a client with cirrhosis. So I'm sitting here. This is a chronic, I always think C for cirrhosis, it's chronic liver failure. They have upper extremity flapping tremor and decreased level of consciousness. So I'm thinking of, if I'm thinking of cirrhosis, I'm thinking, is it a bleeding problem, a fluid problem, or an ammonia problem? So if I remember the upper extremity flapping tremor, that's that stick cirrhosis thing that I can't pronounce. And decreased level of consciousness, those seem like an ammonia issue. So really what this question's asking me is, what is the priority order to complete, or what's going to help ammonia problems, for a patient with cirrhosis? So I'm going to expect that the other, because it's saying, what should I complete first, meaning that I might do all of these things, but which one's going to be most helpful or effective for someone who's having hepatic encephalopathy or an ammonia issue? So I would expect the other ones to be correct, or more applicable to the other problems like the fluid, etc. So the first answer choice is draw a complete blood cell count. So if they're having an ammonia issue, I mean, it's possible. We check a CBC on everybody. And of course, they have other issues probably with their cirrhosis. But I have to ask myself the question, if I draw that, is it going to help me in order to fix their hepatic encephalopathy, or is it going to give me information that's going to help me with the hepatic encephalopathy, like emergently? And not really. That's my judgment so far. Lactulose enema, Q2 hours until awake. So I know lactulose is a treatment for hepatic encephalopathy. I think that sounds appropriate, but I still want to look and see like what the other answers are, because again, all of these could be right, because it's saying what do you do first. Normal saline at 50 mils per hour. So, I'm thinking about ABCs and C for circulation. I like that. They may need some fluid, but I'm also thinking, liver patients, they can be fluid overloaded. I don't know if they'll need that, but again, this is not a fluid question. And sometimes, by the way, when I answer these, I know the answer and that I'm going through these questions, but sometimes I'm talking through like thought processes that you might think, and hopefully that helps to kind of consider if you're having the same thought process as me, where like you could get stuck some places. So I mean, they may or may not need fluids, but again, it's not my job to decide. I'm not saying are these orders appropriate or not. It's just my job to say like, which of these do I need to complete first? So if they have this order, regardless of whether I think they need it or not, it's really asking me, is my priority for hepatic encephalopathy replacing fluids or managing dehydration? And that doesn't seem like my priority. It seems like my priority is like level of consciousness, neuro, and getting them back awake. The last one's insert Foley catheter. So, if they're, having a decreased level of consciousness, I'll probably want to watch their eyes and nose really closely. If they have, liver problems, they can have kidney problems. But again, I have to ask, is it actually going to directly treat? And so this is, sometimes when you're looking at a question like this, you have to think about what's going to most directly be helpful, or which order, if I don't complete, is going to delay care or cause a problem where the patient maybe can't get better. So the only one of these that actually directly treats the hepatic encephalopathy, hepatic encephalopathy is going to be B, the lactulose enema. So I think that is the correct answer, and it is, yay. All right. So question number 3. A nurse is doing a community health presentation regarding ways to reduce risk for acquiring hepatitis C. Which points should be included in their teaching? Select all that apply. So this is teaching. Now we're getting into hepatitis, and specifically hepatitis C. You always want to make sure when you're reading it that you're looking at the right, or which type of hepatitis you're looking at. And you want to always think, is it talking about prevention or is it talking about treatment? So this one's talking about prevention. So answer choice A is avoid travel out of the United States. So I know that there's one that's more common in other countries and stuff with food, etc., but I don't think that's C. And I don't think that we're just going to tell people don't travel out of the US and you won't get hepatitis. That doesn't really sound reasonable. Use of condoms with sexual intercourse. So I know that a lot of stuff with hepatitis is about sex, drugs, and rock and roll, aka what do you call it? There's stuff like IV drug use, stuff like that. And so use of condoms with sexual intercourse seems like it would prevent transmission, or what do you call it? If you use condoms, it's going to help where it won't pass if through sexual contact is one of the ways that someone can acquire. So I like that one so far. So I'm going to say maybe true for B. The next one is encourage regular hand hygiene. So, sometimes I can get caught up on ones like these because I'm like, oh, it's so general. So is it specific to hepatitis C? But I have to think about like, would washing my hands regularly prevent or decrease my risk of getting hepatitis C? And since it's a virus and it can be spread through human contact, I would say absolutely, regular hand hygiene probably would help. Get all 3 doses of the hepatitis C vaccine. So I think that my professor here is trying to trick me because I don't think there is a hepatitis C vaccine. So this is one of the things that you want to kind of keep in mind is that you always want to make sure that as you're reading it that you're looking closely, because it definitely could trick you if you read it super fast and just thought, yeah, vaccination, that's helpful. Because for A and B, vaccination is super helpful and super important. It can take a little while, obviously, for it to take effect if they have an acute hepatitis, but an overall prevention, it's great. Then it says take the temperature regularly to assess for infection. So, with this one, it's asking me, and I'm going to go back to the question because sometimes when I get to one that I'm like, ugh, like, what is it actually asking? It's ways to reduce risk for acquiring hepatitis C. So I have to ask myself, if I take my temperature regularly and assess for infection, is that actually going to stop me from getting hepatitis C? And the answer there is no, it's just going to monitor it. So a question like this, the strategy here is it monitoring it? Like, for example, let's say that, what do you call it? So like if it was a simple question over hypertension, which of the following reduces the risk of hypertension? If it said checking blood pressure daily, well, that doesn't reduce the risk. It just tells me I have it. So it helps me to monitor it, and the patient needs to do that. I don't even know that a patient needs to just check their temperature regularly to see if they have Hep C, but I'm just trying to give you like a parallel. So like, a patient with hypertension, the only way I can reduce my risk is, modifying working on those modifiable risk factors. But just checking my blood pressure is not going to actually change my it's not going to change my risk for hypertension. It's just going to tell me, oh, hey, by the way, you're hypertensive. So same with this, if checking my temperature regularly, it's going to say, hey, you have an infection, but it's not actually going to stop me from like it spreading to me or stop me from getting it. So it seems like the only ones that are specific to hepatitis C are going to be B and C. All right, so question number 4. A nurse is performing an assessment on a client with cirrhosis. What assessment finding would be most indicative that the client is experiencing portal hypertension? So here we go back. We've had a question about hepatic encephalopathy or ammonia issues. We've had a question about varices. So this one is now talking about portal hypertension. So, and really it's kind of testing my knowledge. It's saying what would show me that the patient's having portal hypertension. So, let's kind of look into this. So the first answer is the client has a platelet count of 45,000. So here's the thing, is that a question like this can be really tricky because it's looking at a client with cirrhosis, and a student may read this question and kind of just think it's talking about how do I know that a person is having cirrhosis? So in other words, some of these answer choices here might be general things that a patient with cirrhosis would have, but is it specific that a patient with cirrhosis that is experiencing portal hypertension? So in other words, I need to know what portal hypertension is and how it shows up in a patient. So platelet count of 45,000, I think that's expected for cirrhosis, but I don't think that the portal hypertension would cause them to lose platelets or have low platelets. I think that's just liver failure. The next one says the client has a yellowing of their sclera. So for this one, it's again kind of one of those things where I know they're going to have jaundice, but is the jaundice a result of their portal hypertension? So it seems more general for me versus specifically to talking about portal hypertension. The client is experiencing increased confusion. So with portal hypertension, we have to think about what happens as a result of portal hypertension. And there's a variety of things that can happen, but I don't think necessarily, I usually think increased confusion. I think of the hepatic encephalopathy, like about the ammonia. I don't think about portal hypertension. Let's look at the last one though, because I would be like, that's the only one that I'm like, maybe. And the last one says has a rounded, firm abdomen. So with portal hypertension, if you don't remember, it has to do with there's too much pressure in the blood vessels of the GI system, and there's kind of gets a backup or a blockage where then fluid and other stuff starts backing up. So it can back up into the esophagus and cause esophageal varices, but it can also back up into the abdomen and cause ascites. So this is the only one that sounds like it could possibly be, because a rounded, firm abdomen reminds me of ascites. And so it makes me think that that's probably the right answer. So the hard thing with a question like this is it requires you to not only understand what's normal for cirrhosis versus what's a problem, or, kind of like what problems are going to have. It expects you to understand what portal hypertension is, but it's not just telling you ascites. Like, you have to recognize that ascites is a rounded, firm abdomen. So sometimes students, they can struggle to kind of go across or get through the multiple jumps you have to do there in order to get to this answer. But the best answer here is D. The rounded, firm abdomen is most indicative because it's about ascites. So the correct answer here, and this is again, when you're studying, you always want to think about what would be a different correct answer, what else would be correct, what would be incorrect. So another right answer is if they were having esophageal varices or esophageal bleeding or experiencing a GI bleed, that would be most indicative as well. So question 5, a client with cirrhosis is prescribed lactulose for their hepatic encephalopathy. Which assessment finding after administration would require immediate follow-up? So, that we're talking about a medication. So this is a medication question. And then we're also talking about, it's a medication for hepatic encephalopathy. So here's the thing is always read the question carefully. And you want to kind of tell yourself, okay, is this a med question or is this a disease question? Sometimes it could be a mix of both, but usually it's one or the other. It's saying which assessment finding after administration would require immediate follow-up. So this is a medication question because it's asking what afterward is going to show a sign that hey, something's not right. So usually with med questions, we're either asking, how do we know the med worked, or how do we know there's a problem with the med? And so this is asking, how do we know there's a problem with the med? We'll have to think about lactulose, hepatic encephalopathy. So they have too much ammonia. And so lactulose, literally kind of lassos ammonia in the bowels. And it doesn't literally do that, by the way, but if it helps you and you're a visual person, you want to imagine this medication lassoing up the ammonia, do it. We are in Texas, so it's appropriate. But lactulose, it helps to get some of the extra ammonia out of the bowels. And how do you get stuff out of the bowels? You have to poop it. So they're going to have a lot of bowel movements, is all that I know. So really probably what the other answer choices are going to be here is stuff that's expected for lactulose versus what's a sign of a problem. So, and this should say A, but I guess I never fixed it. So A, or first dot, says the client has had 3 bowel movements in 12 hours. So 3 bowel movements in 12 hours, that would be expected. They can have multiple bowel movements. That's not necessarily a bad thing. And for those of you that are overthinking and saying, oh, they should have had more, it should be 17, not necessarily. We definitely want them to be having multiple bowel movements after their lactulose. That's not unexpected. Or it's not necessarily something that I'm like, oh my God, they've only had 3 bowel movements. Hurry, quick. This needs to be more effective. Now if they said that they haven't pooped in 12 hours, or they, even if they've even had 1 bowel movement, it's still better than nothing, but we do usually expect them to have multiple. The client complains of mild abdominal cramping. Well, we have to think of how this works. It's like it's not I guess you consider it kind of like a laxative, but it's going to cause them to poop. So, I mean, it's with that stuff, and it's leaching stuff or lassoing it from the bowels. That's another L. So a leaching lasso, maybe is a good way to look at it. They can have maybe some cramping, and it's the word mild makes me feel not too scared about it. If it said like intense, worsening, new, different things, like that kind of stuff, I'd be more worried. The client says they feel like their heart is fluttering. I mean, well, I think that's beautiful. Most people don't appreciate that. And if I'm thinking fluttering, I'm thinking some sort of dysrhythmia or abnormality. I mean, that's the first one that sounds actually concerning to me, but I need to make sure it's the best answer. Last one's the client has 2+ edema in bilateral lower extremities. So both C and D, or third dot and fourth dot, they both are abnormalities, whereas like the client having bowel movement, mild abdominal cramping, not too worried about that. So I have to think about which one of these actually requires follow-up, and then which of them, again, what's the kill factor, who's going to die the quickest. So a patient with cirrhosis is probably going to have some bilateral lower edema. It has nothing to do with the lactulose or the hepatic encephalopathy, or the that it has to do all with the albumin and the portal hypertension, etc. So to me, I don't necessarily need immediate follow-up if they have 2+ edema. It kind of just depends on where they were at before. Again, don't create a story though. And so, the only one of these that I feel like if I do not respond to this or look more into this, that the patient could die is they feel like their heart is fluttering. Because that could be a sign of dysrhythmia, because you have to remember you poop potassium. And so if I'm losing potassium, then they can be severe risk for dysrhythmias. Question 6, a nurse is reviewing history for a client admitted with acute liver failure. Which finding is most consistent with this diagnosis? So in other words, it's looking at risk factors for acute liver failure. So remember, we've talked about cirrhosis so far. We've talked about hepatitis. Now this is talking about acute liver failure, which is a little different. So I'm really thinking of like, okay, what is the patient going to tell me that I'm going to be like, oh, that's probably what put you at risk? Oh, and there's medications in this one. I know you all love these. So the client has a history of heart failure and is taking furosemide. So heart failure, I don't know anything about that being related to liver failure, and they're taking furosemide. I mean, that dehydrates you, but I think more kidney issues than I think liver. But I'll keep it on the back burner just in case. History of COPD, takes inhaled steroids. So I know steroids can be hard on the stomach, but I'm not even sure if that's appropriate for it's inhaled. So it's more of like a topical than a systemic. So nothing out here is screaming liver failure to me. Seizure disorders and takes phenytoin. So that's possible. I know that some seizure drugs can cause liver problems. That's the one I like the most so far. And then peripheral artery disease and taking aspirin. So, I mean, I'm thinking aspirin, liver bleeding and stuff like that. What do you call it? And, they definitely, NSAIDs possibly can hurt the liver, not as much as Tylenol, etc. But when I really think about which of these is most directly related to acute liver failure, the top answer, the one that we usually go for here, is going to be stuff like acetaminophen. It's going to be anti-seizure drugs. Also think of those tuberculosis drugs like isoniazid, or again, I used to be able to talk, but apparently I've lost the ability today. Isoniazid, I think it's backwards, isoniazid. But yes, so a lot of the TB drugs, seizure drugs, Tylenol is going to be top up there. Some like high use of a lot of NSAIDs like ibuprofen will probably increase my risk, but taking like a baby aspirin for PAD is not going to be as consistent as it would if they were taking a seizure drug, especially one like phenytoin that can have toxic levels because maybe they're receiving too much. So C is the best answer here. Oh no, forgot to move this over. So it doesn't look as good, but just roll with it with me. So a nurse is creating a plan of care for a client with hepatitis A. Which intervention is most appropriate to include? Don't you just love how we always include this most? So all answers could be right. So the first choice is, oh, and by the way, so let's back up. So plan of care, hepatitis A. So I have to go back and remember hepatitis A. It's like the fecal oral stuff. It's stuff about food. So it's saying what's most appropriate. So for a client with hepatitis A, am I going to administer furosemide as prescribed? So I know for some liver patients, I like furosemide, but I don't think it's hepatitis as much. Limit oral intake to rest the bowels. Well, I know they have some GI stuff going on and they can have a lot of GI symptoms. So that actually sounds pretty good. And if they had like a fecal oral kind of thing, maybe this is something they want to do. So that's what I like the best so far. Space out activities throughout the day. So I know that people with hepatitis can be tired. So it's possible, that maybe spacing out activities throughout the day could work. Then performing serial checks for esophageal bleeding. So I know that with some types of hepatitis, they can become chronic. And as a result of becoming chronic, they can end up having issues like varices. But I wouldn't say it's most appropriate to include, like, my first thought isn't like, ooh, hepatitis, let me look for varices. So I don't really like A or D because I think they're more for chronic versus like chronic liver and stuff like that. So then I'm down to limit oral intake or space out activities throughout the day. So with hepatitis, I would think they actually could get dehydrated, other things like that. They might have a decreased appetite. But I don't really, I kind of like the limit oral intake, but I don't really think that it's appropriate to this patient. Like, why are we resting their bowels? It's not an actual like internal GI issue, even though my brain wants to tell me it. So, I mean, I think out of all of these, the only one that's really appropriate based on their symptoms, like, because again, it'd be kind of like if a patient, was like throwing up and stuff all the time, just tell them, well, just don't eat. Like, like we generally don't want to limit oral intake because I know also when you're fighting viruses, infections, you need good nutrition in order to heal. And I know that especially since the liver does so much with nutrition and nutrients, they're probably going to need some extra help nutrition wise. But I think the big picture here to look at is why are we resting the bowels? That this is not a bowel disorder, it's a liver problem. So the only one that's really appropriate or applies here is spacing out activities throughout the day. So that's going to help because they can have a lot of fatigue issues and they can have a lot of issues just kind of keeping up with day-to-day things. So I'm going to teach them about energy conservation techniques. And then when it's talking about also keep in mind with hepatitis, we don't have this patient NPO. They're allowed to eat. We usually want to encourage good nutrition. So anyway, that was my last one. I hope you had as much fun doing the liver with me as I did. I'll see you for the next one.